Diabetes is a condition where the glucose in the blood is higher than normal. Around 280 people are diagnosed every day with diabetes, and approximately 1 in 5 older Australians have diabetes. Type 2 diabetes is the most common form of diabetes, currently affecting 1.7 million people in Australia. Initially, type 2 diabetes can be managed with healthy eating and exercise, but over time, medicines may be required, and this might include insulin.
Dementia is a brain disorder, usually occurring in later life, and it affects mainly cognition, so thinking abilities, but it goes beyond that. It also affects emotion and behavior and the ability ultimately to live an independent life. In Australia, the most common cause of dementia is Alzheimer's disease, but other very common dementia types are vascular dementia, Lewy body dementia, and frontotemporal dementia. Dementia and the symptoms of dementia are clearly a medical condition. It's not part of normal aging. Age or increasing age is the most important risk factor for dementia. So if you look, for example, at the Australian population 65 and older, almost 1 in 10 has dementia. If you look at Australians who are 85 and older, it goes up to 3 in 10. Currently, we think that approximately 1,700 new cases are diagnosed each week in Australia, and those would be only people who have sought help and have seen their doctor and have received a diagnosis. But we do know that there are many more older Australians who might not see their GP about their symptoms, so are undiagnosed. Mild cognitive impairment basically describes a condition where an older person notices that mainly the short-term memory is changing. It's a bit harder to remember appointments, they need to keep a diary, they might forget more easily what happened yesterday. But it usually doesn't impact or doesn't affect their daily or weekly routine, so they are still completely independent. Mild cognitive impairment can have other causes, and it does not always lead to dementia. However, we do know it's a significant risk factor, so it's important for people who receive a diagnosis of mild cognitive impairment to have regular appointments, for example, with a specialist, to monitor whether the memory problems do get worse or not. People with diabetes have statistically an increased risk to develop dementia when they get older. However, the majority of people with diabetes will not develop dementia. There are differences between type 1 and type 2 diabetes, with type 2 diabetes, which is the more common form in older people, having a higher risk to develop dementia compared to type 1. For people who do not have diabetes, the risk of developing dementia is about 10%, and for people with type 2 diabetes, the risk is about 20%. The link between dementia and diabetes involves many different factors. High blood glucose levels, which is known as hyperglycemia, can damage the cells and blood vessels in the brain. And when blood vessels in the brain are damaged, brain cells may not get enough oxygen and nutrients to function properly, and they may die. Secondly, insulin resistance causes the body to produce higher levels of insulin to try to keep blood glucose levels within the normal range, and high levels of insulin can cause damage to blood vessels and cells in the brain. Also, diabetes may contribute to the buildup of proteins in the brain that are associated with Alzheimer's disease. The first symptoms of dementia can be very subtle, and very often they look similar to age-related changes to memory function. Common signs and symptoms of dementia include forgetting recent events or conversations, confusing times or places, losing things frequently, for example, wallet or keys, difficulties with language or communication, difficulty managing money, personality changes, apathy and withdrawal, reduced ability in doing well-known tasks, for example cooking, changes to physical abilities, and slowing in motor skills.
Some of the signs that a carer may notice in someone with diabetes as dementia develops are unexplained weight loss, forgetting to do their usual self-care tasks such as monitoring their blood glucose level or forgetting a certain aspect of monitoring.
Some people with diabetes are at risk of hypoglycemia, commonly known as a hypo. And obviously, if a person is experiencing the first symptoms of dementia, they might have these episodes more often because they find it more difficult to manage their diabetes. Hypos have been linked to a higher risk of dementia, which is another reason why it is important to avoid hypos and to keep blood glucose levels within the target range.
Some signs and symptoms of poorly managed diabetes are similar to signs and symptoms of dementia. If you notice a change in a person's behaviour or increased confusion, always consider both possible causes. Report any concerns or changes and make sure they are followed up.
Dementia is difficult to diagnose, especially in the early stages, and that's where the help of a specialist very often is very useful. Early detection of dementia is important because it gives the family more time to plan for the future. A diagnosis helps to understand the symptoms and to understand that they're caused by a medical condition, so it reduces also stress in the family not knowing what's going on. Treatment for dementia depends on what the underlying cause is. For most causes of dementia, there is no curative treatment available at this point in time. However, there's lots of research happening both in Australia and internationally to make a change about that. For the most common cause of dementia, Alzheimer's disease, there is medicine available which can help to improve symptoms for a while, but more importantly can help to slow down the progression of the disorder.
So some of the things that you can do to reduce your risk of developing dementia is keeping your blood glucose levels within the recommended range, keep your blood pressure and cholesterol within the recommended range, take all your prescribed medicines, eat nutritious foods, eat at regular intervals, maintain a healthy weight, and keep physically active.
Receiving a diagnosis of dementia is obviously a very challenging time for a person with dementia and the family. But it's important to keep in mind that once they come to this point, they can receive lots of additional support and help in the community via the doctor and via Alzheimer's Australia Vic. It also helps then to plan for the future and to understand the symptoms better.